Great, thank you, Simone. So yeah, I'm going to shift our attention to talk about well-being, specifically mental health today. And we're going to be looking at really those intersections of campus climate. So building on some of the things that Simone mentioned in his presentation, I will draw on both of our Canadian studies, including the one that used the 2016 NCHA data. But this really, all of these projects are very much a team effort. And so I'm representing a large group of very committed individuals who've been working on these projects to try to illuminate the experiences and the strengths and the well-being and academics of 2SLGBTQ students. As many of us know, when we think about mental health, there is certainly a growing crisis on campuses in Canada and beyond. Lots of media attention to issues of mental health, of student mental health, student advocacy, of course, around student mental health issues and responsiveness of services, our own practice experiences and seeing changing and growing needs throughout the years, also changes in approaches and such. We've also made some progress, and we have institutions and groups supporting us, such as the here in Ontario, the Centre for Innovation in Campus Mental Health, doing some work to support campuses, and also the national standards that were developed for the mental health and well-being for post-secondary students. But when we turn to specifically to the idea of a growing crisis, this is from a blog posted by the Mental Health Commission of Canada, and speaking up about student mental health, and I'll just quickly read it. To say I was not fully prepared for post-secondary studies is an understatement. It's not a question of intelligence or academic ability. It had more to do with my mental health and lack of support. Yes, against all odds, I was successful and graduated from university. How did I manage to complete my degree? Sheer grit and determination. So picking up on some of those themes around thriving and some of those things that Chris had mentioned, and sort of that resilience that students demonstrate. This author goes on to say, the fact is that not all students come to the post-secondary journey on an equal footing, and they actually talk about students living in poverty in this blog posting. But as we heard from Chris's presentation this morning, the context, the climate, what students bring with them, but also their experiences on campus, so their inputs and the experiences that happen. And that's where many of us are focused, is around the student experience, so that context and such. Certainly, research shows that 2SLGBTQ students experience poorer mental health compared to their cisgender and heterosexual colleagues. And one study in the US found that approximately 1 in 5 queer spectrum students reported that they had seriously considered suicide in the previous 12 months, and that was 3 times higher than their heterosexual cisgender counterparts. So if we turn to what's happening here in Canada, again, this is from the 2016 NCHA, the National College Health Assessment. So in the Canadian implementation of that study, you can see here that compared to cisgender heterosexual students across all of these areas of mental health, that LGBTQ+ students are reporting more challenges. So this is quite important for us to be thinking about. Interestingly, in this version of the survey, there were some additional questions added by the Canadian group, including this last one called flourishing, which is an indicator of positive mental health, which we'll talk about. So if you think about the percentage of these students in each of these groups, you can see that more LGBTQ students were diagnosed with anxiety compared to the percentage of cisgender heterosexual students, and we see a common pattern across all of these indicators. If we look at within LGBTQ students, as Simone had mentioned earlier, that we do find consistently across these studies that trans students compared to their cisgender LGBTQ students or counterparts tend to be faring worse as well. The only thing we see where there's very close difference and not a significantly difference, it would be in terms of that positive mental health. We'll unpack that a little bit more as we move along. So why, and then if we look at intersecting identities, so going a little bit further, we do find that when we look at racialized students, that they reported higher rates of attempted suicide. So amongst the sexual and gender minority students, that race was a risk factor, and also lower rates of flourishing. Then similarly, when we look at disability, we see that students who are part of the queer community who are also disabled are reporting more are at risk for other, at our increased risk for these negative outcomes. So considering suicide, attempted suicide, anxiety and depression diagnosis and lower rates of flourishing. So this really brings to our attention the need to be thinking about holistically looking at students beyond their gender and sexuality, but also looking at race and disability, as these two illustrate. So why is this happening? What's going on? So what might be some of the factors? So building on what Chris had mentioned earlier this morning, in terms of the model that we use to try to understand the inputs, experiences, and the outputs for students, we use also this theory of minority stress theory, which basically says that in addition to the general stressors that all people face, so we talk about students, that all students face, those who come from minoritized communities face additional stressors related to those minoritized identities. So these distal minority stressors would be including things like discrimination. So when we talk about discrimination, when we use that word, people often think things that are blatant, intentional, but of course we know that microaggressions, those subtle, often unintentional forms of microaggressions or discrimination also matter. We think about as well, part of that distal minority stressors would be the anticipation of discrimination. So if you have a young person who in high school was bullied because they're non-binary, and so they're going to university, they're probably going to anticipate that's going to happen, or they've had negative experiences on campus, so they think it's going to be an ongoing experience for them. So that anticipatory discrimination is another aspect of that. In addition to that, we also have this experience of the internalized discrimination. So such as those taking those negative messages, that queer people are abnormal, or those kinds of messages, and internalizing those things. All of these things together help to explain why is it these mental health outcomes, why is it that 2SLGBTQ students are at increased risk for poor mental health compared to their counterparts. And so this model says that basically as a minority, we live with this chronic stress, and this chronic stress contributes to those negative outcomes. So it's very much a social kind of orientation to understanding mental health, which is really aligns with what we do on campuses. The thing also that this model adds is these protective factors. So are there certain factors that can help buffer? And Simone mentioned some of those earlier with respect to academics. So we're going to be looking at a little bit of that today in our presentation. The thing that I really appreciate about this model is that we can think about opportunities for change here. So if we think about policies prevention, that campus climate work that we do, also that policy work we do, can help to reduce those distal and proximal stressors. But also, what kind of protective factors can we put in? What kinds of things can we implement on campuses to help buffer students from the negative effects of a hostile climate, for example? So what does the research aligned with minority stress theory tell us? So drawing on US studies, that we find that victimization can contribute to negative outcomes such as psychological distress, increased risk for suicidality, and also substance use problems. Starting to shift into the more subtle forms of discrimination, research looking at heterosexist harassment, so things like being criticized for being too femme if you're identifying as a man, for example. Incivility, which would be those disrespectful behaviors, that they also can put students at increased risk for anxiety, depression, and problematic drinking. And as Chris mentioned, we have done some work around microaggressions and looking specifically at LGBTQ students, so cisgender LGBTQ students, we find increased risk for both depression and suicide. One of the things we've been able to do in our work, so building on, and in the national study that Chris mentioned earlier, the one done in the US, is that we're really able to look at separating the experiences of cisgender LGBTQ students and trans students. And so looking specifically at trans students, we know that victimization, so those blatant forms such as being physically assaulted, being verbally threatened, increased students' risk for attempted suicide. So that's a pretty significant stressor to think about. Also trans microaggressions, specifically increased risk for depression. And looking at the environment, and this would be an example of, these two things here would be examples of environmental microaggressions, not having access to bathrooms where you feel comfortable as a trans person, and the lack of gender inclusive housing was associated or related to students reporting lower sense of social acceptance on campus. And we think about social acceptance as an aspect of belonging. And as we know, belonging is so critical to academic success, also critical to one's mental health. So one of the things we know is that the research, even those studies we just cited, are really coming from a limited perspective and understanding of mental health. And we need to be thinking more comprehensively or holistically about mental health. And so we want to move away from just a pure focus on negative indicators such as anxiety and depression to looking more holistically by looking at positive mental health as well. And as I mentioned, the 2016 version of the National College Health Assessment that was done in Canada did ask about positive mental health. And so in the Thriving study, we were able to build on that. That's looking at things such as my satisfaction in life, my sense of self-acceptance, and also my social contribution. So it's really measuring emotional, psychological, and social well-being, so which is really positive. So we want to go a little bit further in terms of the 2016 National College Health Assessment and our analysis looking at the experiences of LGBTQ students in that. And so what did we find here? So in terms of experiences of the campus climate, we found that LGBTQ students compared to their heterosexual cisgender counterparts, tended to report higher rates of victimization, so physical violence, physical assault, those kinds of things, sexual assault as well. And also reported lower feelings of safety on campus and in the larger environment. And these in turn were associated with a greater odds, so more likelihood of being diagnosed with depression in the past year, attempting suicide in the past year, and also in the past month experiencing lower flourishing. So again, we're looking at these, how the context, the climate matters for students in this way. So this is really important, and it helps us to say, okay, we need to be doing work specifically with 2SLGBTQ students. So one of the things for Thriving is that we've been able to unpack that further. And so turning to the Thriving study, which is specifically a 2SLGBTQ focused study done here in Ontario, that we're able to ask some very specific questions related to the climate, including microaggressions and such. We did include both victimization and incivility in our survey. So those are general measures, but we also included our trans microaggression scale and our LGBTQ microaggression scale. Earlier, Chris mentioned that we developed the LGBTQ microaggression scale out of the US data. We used US data and some Canadian pilot data to develop the trans scale as well. We just haven't published the trans scale yet. So these are a couple of statistics coming from the Thriving study, and you can find these in our report number 2. But this is an example of victimization, and what we're able to do with the Thriving study, because of the large size of our trans population or trans students, we're able to look at nuances related to gender. So not just grouping all trans students together, but being able to look at non-binary, trans women spectrum, trans man spectrum, cisgender women's spectrum, and cisgender men. So being able to look at some of those important nuances and finding some differences, and we will find, as reported in that document, that you'll look at different indicators of victimization and see that there's not necessarily a consistent pattern. So which says to us, if we're going to address sexual violence on campus, we need to be thinking specifically about data related to that. Here's some illustrations of findings from the related to microaggressions. Both of these are looking at the percentage of students who reported experiencing these particular forms of microaggressions, so these everyday forms of discrimination, at either frequently or very frequently in the past year. So those were the two higher end options on the response set. And you can see here a mixture of both interpersonal discrimination, such as someone used the incorrect pronouns when referring to me for the trans one, and also some environmental or systems ones, such as I received information about sexual health that was limited to heterosexual sex. So when we think about how responsive are we being to students, we need to be thinking about how our systems, the services we offer, are really responsive to 2SLGBTQ students. We also, as part of our climate survey, we asked about things related to the anticipatory discrimination. And so I worry that, and so Simone talked about our perceptions of climate scale, and these are some particular questions that were asked there. And you can see here that things like, I worry that I'm going to be stared at or whispered, I'm worried that I'm going to be sexually assaulted. And you can see generally that in terms of trans students, that rates tend to be more trans students are worried about these things. And this is reporting it just as a dichotomous thing. But we have other nuanced data about this as well. So these are important, and you can see a mixture here of subtle things, being stared at, being whispered about, avoid talking with me, to more blatant forms of discrimination. Related to the perceptions of the climate, again, you'll find this in report number 2 for the Thriving study, that you can see here, these are all of our indicators and aspects of the psychological or perceived climate. And you can see in terms of what we've reported that lots of the data tends to be around neutral. So we would love to see students who are saying, I feel very positive. So even though things may be affirming, that we're really seeing, that it's not highly affirming. And then with the exceptions of collective attitudes, the perceptions of trans students tend to be significantly worse or lower in terms of their inclusion. So let's think about, what does this mean for students' mental health? As I mentioned in our Thriving study, we built on the work that was done in that 2016 National College Health Assessment, and 2 of our mental health indicators looked at psychological distress. So this would be a combination of depression and anxiety, and it would be students reporting the symptoms of these issues in the past 2 weeks, excuse me, and then moving into past month, the positive mental health. And so we did find, interestingly, significant differences across both of these indicators based on gender, and most often non-binary students tended to have the lowest well-being, and cisgender men had the highest well-being. So when we move into what does this mean in that intersection for campus climate? So what this slide is telling us is that when we look at these different forms of discrimination, that they have differential impacts depending on what we're talking about in terms of their the form of mental health. But essentially, when we think about the things that are statistically significant, which are represented by the blue arrows, we find that students who reported greater discrimination tended to report higher distress and lower positive mental health across. Interestingly, for trans students, we're seeing that positive mental health, that these aspects of experiential discrimination are not having a significant relationship, which we need to delve into further. Similarly, when we look at these perceptions of the climate that we're seeing in terms of those significant relationships, students who reported greater perceptions of affirming climate tended to report lower distress and greater positive mental health. So of course, keep in mind that distress is something that's negative. So we would hope to see arrows on this case going down, and positive mental health is something that's positive. Obviously, if we want students to report more of it, that's why the arrows go in a different direction. So one of the things we also want to look at, what are those resilience promoting factors? So when we think about resilience in the case of adversity, what are those things that help to promote positive well-being, positive levels of strength within that? And certainly we try to build on existing research and previous research to look at not just things at the individual and community level, but also looking at what's happening at the university level as well. So what we find from previous research is that they're at the individual level. So in terms of the student themselves, things like self-acceptance, self-esteem, physical exercise. So the more often you exercise is a protective factor. So it helps to lower the negative effects of heterosexist harassment in particular, but also individual resilience can be a positive thing in terms of lowering the risk for depression and suicide, attempted suicide. Looking though, moving beyond that at the more community or interpersonal level, having LGBTQ friends, having positive peer relations, having instructor relations. So that would be things like, I feel like I can approach my professors, those kinds of things. Affirming faculty. Chris talked about the trans kinship and the connectedness. All of these things can promote positive well-being and belonging on campuses, and in some cases, in fact, moderate the relationship between discrimination and health outcomes. When we go to the structural level, so that sort of campus structural environment, inclusive policies can, on campuses, research has shown that inclusive policies are, students who are on campuses that have inclusive policies tend to report lower experiences of heterosexist discrimination, and that in turn can lead to higher levels of positive mental health and such. Resource centers are critical, inclusive facilities and resources, involvement in campus groups and such. So this is building on some of the things that Chris mentioned earlier. When we go to the Thriving study, we've just started to look into these things, but we did, for example, find some promising results. So when we think about representation and who's on campuses, that for cisgender students, that having more LGBTQ faculty and staff, knowing more out 2SLGBTQ faculty and staff performed as a protective factor with respect to more poorer perceptions of the climate in terms of collective attitudes, institutional leadership, and also them worrying about that. We do want to start looking at other potential factors for the study, and then also looking at how intersecting identities are playing out more, especially amongst subgroups. And we have a large enough sample to be able to do some of that work as well. And so we look forward to sharing that with you down the road. So what does this mean for us? Certainly, it means we need to do work around equitable services. But however, we also have data from Thriving that is saying students are not necessarily facing that in terms of health and wellness services. And so this is a quote from a student, a trans non-binary student, an undergrad student, who says that, as soon as they came out and said they were queer, that their counselor assumed that, well, that's why you're depressed. So that's, an example of a microaggression. And so the student, talked about that and what that meant for them. Also, we have data in Thriving, and one of our service groups today will unpack this a little bit further, where we asked students about who used psychological counseling services in the past year, about their use and their perceptions of those. And if we just look at the last line, we can see here that non-binary students had the lowest level of affirmation. So, approximately 40% of them did not report a positive response in terms of their overall satisfaction. And we see a similar trend across the other two groups of students. Because this is about people who use the service in the past year, we're not able to do a more nuanced look at gender in this one. So what do we do? So this is a model that we use in our work to think about. We need to be doing work on the front end in terms of prevention, so policy awareness, working with faculty to be forms of support, but also working with students to ensure they have spaces where they can have that peer support. In terms of facilitating student support and belonging, formal support groups, having queer and trans student centers, the informal support that can happen. So ensuring that there's spaces, times for students to gather, and there's mechanisms for students to create some of those organic kinds of peer groups and such. And similarly, if you go to our reports, you'll hear some qualitative data that is students highlighting that. When we think about the treatment side of things on the mental health services, we need to ensure that our services are responsive, that there's a commitment essentially throughout all levels, and that we need to be able to build in not just the rainbow sticker, but we need to move beyond that. So I'm going to end it at this point and open it up for discussion. And so we welcome that. And so Corey, I'll just turn it over to you.
Yes, greetings everyone. And thanks to Michael and Simone for their presentations and Chris's beforehand. Now's the time to chat with questions, if you like, in the Q&A chat. Michael, there was one question that maybe you or Simone could address that was sort of offered in the middle of the presentation. So I'm not sure if it was directed towards Chris, Simone, or you, but maybe one of the two of you can respond to, in the opinion, what are some of the institutions we should be looking at as models in leaders of integration of policies and practices to support 2LGBTQ+ students and staff?
Thanks, Corey. I can take that. I think it was a question that came up earlier in Chris's talk. So I think we're all at different stages, and certainly part of the Thriving study, we also did a review of policies and resources and where campuses are. And that is I think folks are at different places, different capacities and such, and I have to say the field is evolving so quickly, which is wonderful as well. I will say, Chris had mentioned I was in the US for a number of years and returned to Canada. And, I'm seeing, so for example, my former institution, University of Michigan, also Michigan State, where Chris is located, I think in the US are seen as leaders in some of those larger schools. What I would really love to learn more about are some of the leaders that tend to be smaller schools. And so, I have great pride about the work we're doing here at Laurier, for example. And, we are one of the we're a mid-sized school, for example. So maybe we can think about conversations in our work groups around that. Thanks.
Mm-hmm. So another question we have is from Jocelyn at the University of Windsor. Says there's a lot of staff engaged in our initiatives for training, but they're struggling to engage faculty. Are there ideas on how they can engage faculty more fully and richly?
Yeah, I think this is wonderful. I'm wondering about the, with the pandemic, the accessibility of things like webinars and things like that. I know I personally, as a faculty member, I've taken that as an opportunity to learn and engage and learn from colleagues around the globe. So trying to promote some of those things. I also know that in some institutions, in terms of like faculty annual reports, that they're asking questions related to EDI, and so maybe sometimes faculty need that kind of encouragement as well. And so, but I also think. Is there a possibility within a particular faculty or department, that there's a bit of an informal champion who takes on some of those roles as well? Yeah. So.
And then I also can add that I think these champions are probably key, and I wonder if the pandemic, like Michael said, has played also a role in some way. And we know like a lot of faculty members, like staff, but also have been also burnt out by the pandemic more broadly. So I think maybe things are going to go back to a certain normal, and then it's going to be a better time to kind of try to engage people. That's my these are my thoughts on this.
Great.
Agree.
Well, thank you all very much for your talks. That's all the questions we have at this moment. So if you could all help me again, thank Michael and Simone for their wonderful presentation and the important information and work that they continue to do to support the thriving communities on our campuses.